Okay. Okay, good morning, everybody. If you could quickly take your seats, that would be much appreciated. Okay, shall we get started on the final plenary session of the World Congress? Thank you very much. I have to start with a administrative notice, and this, so pay attention, everybody. This could affect your well-being. So it says here, first bus to the post-Congress Marstrand dinner will depart at 4 from Lillebergsgatan. Thank you very much. For those of you who are joining. So same place as the buses for the Congress dinner. Remember to pick up your ferry tickets at the information desk. There we go. All right, so well done everybody. We've made it through to the final day. It's been a fabulous conference. It seems a long time since we all discovered that we were individually sexy nerds back on the first day of the conference. So well done for making it through. It's very nice to see you all here right now. My name's Ben Groom. I'm from the London School of Economics. I work in the Department of Geography and Environment. And I would like to sort of thank the Gothenburg team again. I know this happens every day, but they've done a really spectacular job organizing the conference, and it's gone so incredibly well. So give them a round of applause, please. And walking around the conference the past few days, it's been clear that you've really enjoyed yourselves. You've taken Thomas's advice and had fun, and the feedback on all the sessions has been fantastic. I've been to a number of different sessions. They've all been very high quality. They've all been packed. It's been amazing. And so I think I'd like to thank you all for submitting your wonderful papers to the conference and for bringing your A game to the presentation. So give yourselves a round of applause, please, everybody. So that's terrific. Now, we're at the final plenary session, and I have the great pleasure of introducing the final plenary speaker, keynote speaker. Now, did I mention I was at the Department of Geography and Environment at the London School of Economics? Yeah, I thought so. Well, it turns out that there is another department at the London School of Economics, and it's known as the Department of Economics. And we're very lucky to have one of their brightest stars as Professor Nava Ashraf as our keynote speaker today. Nava received her PhD in 2005, like me, actually. But in terms of career trajectory, that's pretty much where the similarities end. In addition to Nava's position at the LSE, her chair at the LSE, she's the lead academic at the International Growth Center for Zambia. The International Growth Center is funded by Department for International Development, and their objective is to fund, ensure sustainable growth in developing countries. So that's one thing. She's also one of the lead academics at the Jameel Poverty Action Lab, the JPAL, that we know as JPAL, which is at the MIT. And she's also director of research at the Marshall Institute, which is an institute which tries to funnel philanthropic money, private money, towards the social good via research and teaching and so forth. Her thesis was entitled Essays at the Intersection of Development and Behavioral Economics, a topic which at the outset she had to fight to convince other people would be worthwhile. Since then, she has published at the highest level, by which I mean the mythical top 5 journals. And to continue the kind of mythical theme, one of my favorite papers of hers is entitled Tying Odysseus to the Mast. Excuse me. The focus of her research is really on behavioral economics and how that can inform the choice of instruments and how we inform our policies, and really with the objective of improving human well-being at the end of the day in a development context. Her work has also included a wide range of topics within this genre on gender inequality, female empowerment, and excess fertility, to work on the counterintuitive role of prices in providing goods for health and other such public purposes. All of this research is done with an unerring objective of understanding human nature and for the purpose of improving human well-being and human development. So in the end, Nava really has stuck to her guns and proved her doubters wrong. I've only recently met Nava. It's one of the joys of being invited to help organize the conference, and as part of my modest contribution to that, we've met a number of times, and I now know that she's a very welcoming and warm person. So please reciprocate on my behalf and give Nava a very warm welcome.
Thank you, Ben. Good morning, everyone. It's such a pleasure to be with you all today. Let me share with you something that has motivated much of my work, especially for the last 10 years, which is the fact that every year more than 13 million needless deaths occur from conditions for which there exist safe, affordable, effective prevention and treatment options. So insecticide-treated mosquito nets to prevent malaria, condoms to prevent HIV/AIDS, water purification solution to prevent waterborne illnesses. In fact, more than 63% of deaths for children under 5 could be prevented from currently existing simple health products. We just can't figure out how to get them to people and how to get people to use them. And the problem in this sector of global health is really not resources. A very conservative estimate puts annual spending at $9.3 billion. That's very conservative. And you know, the thing is that this isn't just in the global health sector. When you look at the majority of the Sustainable Development Goals, they have the same feature. We have the solutions, we have the technology, the resources exist. So what's the underlying problem? In reflecting in the global health space, I've come to realize that maybe the way we thought about this problem is the problem itself. We thought of things like health as things we give to people. But they're not things we give to people. Health is something that people create themselves. Health, education, a better environment, development. These are things that people produce interacting with the kinds of products and policies and programs that we design. Understanding the nature of that co-production is absolutely essential for us to be able to make the impact that we can. So take health, for example. This is a picture of a clinic from a clinic that I work with in Zambia. And this is kind of health being co-produced. There's the patient side and the supply and the kind of provider side or the supply side. And you know, from the patient side, she had to think about 100 things in order to be able to show up at that clinic. She probably had to negotiate with her husband. She had to think about delaying a lot of other decisions. To be able to access this care and show up. And then on the provider side, you know, there was no guarantee. This is very uncommon, actually, to see a nurse. So it would have been, you know, no guarantee that she would have had any provider on that side. So we also need to understand what motivates someone to show up and be effective on the provider side in order for this co-production to actually occur. And so much of my work is really about getting inside the head and the heart of the end user so that we can understand the factors that will lead to this co-production. And so on the demand side, today I'm going to talk about the types of factors that help the end user access and use kind of really vitally needed health products and other things that can improve their life. So What's the role of pricing? Getting inside the household, what's the role of differences in preferences for fertility, and the role of cultural and sociological factors? And what's the role of behaviorally designing with insights in mind so that we can offer this to people? And then on the supply side, thinking, what are the types of innovative distribution channels we can use to help people access new technologies, to help people use them, to find the right motivations, particularly altruistic motivations, which of course can pervade all types of public service delivery and environmental behavior. How do we leverage and target that kind of altruistic motivation to bring the best out in people who are delivering public services? So to go inside the demand side. This is this first paper is motivated by a problem which is a deep environmental problem as well, and a massive resource in the world, which is how we provide clean water to everyone. Now, there is a huge amount of money in this sector as well. Something like 30 billion is spent on infrastructure around the world in developing countries. The thing is that this infrastructure is often really faulty and often has systems go out. So in Lusaka, Zambia, where I work, I've been working for the past 15 years, even if you take a very small, you can basically grid up the city into small water districts. And each of these very small water districts gets a complaint of outage, of the pipe system once every 2 or 3 days. What we did is we geocoded the entire city, working with the water and sanitation services, to look at all the piping system in the city. And then we overlaid that with the geocodes of all the health clinics, gathering all the administrative data of health outcomes, all the schools, gathering administrative data from the schools, and mobile money transactions, so that we could estimate how important is it to have safe and reliable access to water for all of these outcomes of life. And what we find is a 1 standard deviation in outages. So not just not having access to water, but just having an outage is associated with 12% increase in cases of diarrhea and a 22% increase in typhoid fever. We might expect that, but then we also see a significant decline in financial transactions and a significant increase in girls spending their time doing chores rather than homework and spending time in school. And so these are massive knock-on effects that come from not having this access. Now, there is an interim solution while we get the infrastructure right. And that is, this is chlorine, which is essentially diluted bleach, but it's a very simple and effective way to purify water. It's incredibly cheap. So for a family of 6 weeks' worth is less than a week's worth of sugar. Everybody knows about it. So in Lusaka, 99% of people had heard about chlorine, and most of them had used it at least once. But uptake remains really low, so 20 to 30%. And the question is, how should we then distribute and help people to use this? This is sort of one of those vitally needed health products that Jeff Sachs might suggest we should provide for free in order to make sure people use it. On the other side, there is a kind of view among social marketing organizations that actually, if you provide something for free, people are not going to value it. And so you need to price something in order for people to value it. So the fundamental question is whether prices actually facilitate more product use. Now, there's multiple factors there. They could facilitate more product use through a basic economic screening effect, right? So just, prices, people who are willing to pay higher prices are willing to use at higher levels. And this allows you to allocate to the most efficient allocation. It could come from a sunk cost effect, that the fact that I pay actually makes a difference in my commitment to use it. Or it could come from an information effect, that the prices actually signal quality. In this study, we're going to shut down the information channel because, as you see, most people actually, 99% of people had actually known about it. And we're going to try to distinguish the first two. The thing is, it's actually pretty important to distinguish the first two, even though they go in the same direction, because they have very different implications for policy. If it's just a screening effect at work, then what matters is if you have a resource constraint, a budget constraint or a small amount of this resource, you'll want to make sure you allocate it to those who are going to use. And that's if there's no psychological effect. But even if you don't have a resource constraint, if there is a psychological effect, you're going to want to price anyway, even without a resource constraint, because it's going to commit people to using it. The problem is this is very, very hard to tell with observational data. So if I look at Ben and I see that Ben paid just a whole bunch of money for his new, I was going to say Walkman, but that sort of shows my age, for a new great technology, and he uses it all the time. You know, he has his earphones in all the time using it. And I just don't know if that's because Ben's the kind of person who values that and therefore uses it, or it's because he actually paid for it and he's like, I better get my money's worth out of this. I can't tell that apart by just looking at him. So we need an experimental design to be able to untangle these effects and understand the implications for policy. So that's what we did. We did a 2-part study with thousands of consumers in Lusaka, and we randomized door to door, offering this product, the chlorine product, at randomized prices on offer. That first stage allows us to identify the willingness to pay of the consumer. Then, and that allows us to see the screening effect. Then, if they accept at that price, what we say to them is, you may be eligible for further discounts. And we give them an envelope that's sealed. Inside the envelope is a coupon for a potential further discount. That coupon determines their actual transaction price. So that's the price that they're actually going to pay. So now I know, conditional on your willingness to pay, what is the effect of the price you actually had to pay for the good? And we balance the randomization such that we're able to identify both the effect of paying something, you know, did I have to reach in my pocket and pay something versus zero, and the price across, you know, if I had to pay more, was I more likely to use? What we find is, first we find what you might expect and what has been replicated everywhere, which is a very steep downward demand curve for willingness to pay for preventative health. So we estimate an elasticity of about negative 0.6. And this is sort of consistent with the very steep downward demand curve for other preventative health products as well as for environmental goods. But then we also find a significant screening effect. So as people sort of drop off in the demand curve, everyone that remains is increasingly likely to use, leading to a screening effect of positive 0.3 or 0.4. And this efficiency of allocation actually doesn't come at the cost of people who you might really want to use from a health impact perspective. So for example, mothers with children under 5. None of those are crowded out by the pricing. And then there's a small effect of the amount paid, although no effect from kind of from a sunk cost basis of the more you pay, the more you use. So we bring this together in a kind of structural model to estimate the effects of pricing policy on providing preventative water purification solution. And what you find is that, you know, the green line is basically if the demand curve was equal to the usage curve, you know, and we just sort of assume that's going to be a very steep downward demand, and therefore, you know, you really should probably, in order to maximize usage and efficiency, offer it at 0. However, the strong existence of the screening effect means, and that's this pink line and the top blue one. The top blue one just has, by the way, a little bump at the top to be able to accommodate the fact that if you pay something, if you have to reach in your pocket for something, there is suggestive evidence that you're a little bit more likely to use, but the rest of it is very similar to the pink curve, which is the screening effect curve. But essentially what this shows you is that the screening effect means that your subsidy goes almost twice as far. Without screening, you'd have to cut prices in half to get the same use. But it allows you to use pricing as a device. to be able to allocate efficiently. Okay, so that's within, the individual interacting with the market and within prices to be able to use existing technologies. Now let's go inside the household, particularly when there are two people inside the household making decisions about something that matters tremendously, not only for the household, but for the planet at large, which is fertility. So, despite one of the most extraordinary technological innovations of the 20th century, which is the existence of modern contraception, and the extensive spread of modern contraception in developing countries, there are still very, very high fertility rates around the developing world. And what is called unwanted births or excess fertility, which is when women say that they wanted more kids than they actually had, even ex post, which is quite a high bar. This is usually assumed to be because of lack of access. And by access, it could be, availability, prices, or just information. At the same time, while I was doing fieldwork on the chlorine study, and I was talking to women after our study about how they kind of use the money and various other situations in their life, they started talking to me about their husband's desire to have a lot of kids and how they'd have to sometimes hide contraception from their husbands. And then I saw this in the clinic we were working at in Zambia, which is a cartoon where the nurse is saying, the baby gave you 9 months' notice, where are the napkins and shawls and everything? And the husband's saying, there's nothing at all, we have problems in feeding and dressing the other 10 children that are at home. That seems an exaggeration, but actually fertility rates in rural areas are up to 8 or so. I'm working, this project you're going to see is in peri-urban Lusaka, where the fertility rate is at 5.6. She says, you men are to blame because you always discourage your wife to use any of the many family planning methods. And there's poverty and disease and hunger that's surrounding them. And then the husband has changed his mind and he says, never again, darling, family planning makes sense. And when I saw this, and I was talking to the women, and they were telling me about what's going on in their home, I realized that these intra-household factors have not at all been incorporated into our economic models of decision-making about fertility. But how do we actually figure out if this is something of importance or not, rather than just sort of anecdotal or in a cartoon? And so we designed a field experiment to be able to provide completely guaranteed access, and then be able to isolate the role of the intra-household factors from the role of access itself. So this is the coupon that we used, and basically while modern contraception, including longer-term and concealable contraceptives like injectables and implants, are available for free, they're often out of stock. So this voucher gave women the opportunity to have it for free, guaranteed, with less than a half an hour of wait time. And half of the group got this voucher and half was in control. But then, within the group that got the voucher, we randomized whether people got the voucher, whether women got the voucher alone or in the presence of their husbands, so that we could isolate the intra-household factors. And when we compare whether women receive the voucher alone or in the presence of their husbands, we find that when women receive the voucher alone, they were 23% more likely to go and visit a family planning nurse, 38% more likely to take up a concealable form of contraception, which is these injectables that you can't see, leading to a 57% reduction in unwanted births. Note that also from a social welfare perspective, unwanted births are particularly bad because they're particularly associated with negative health outcomes, negative intergenerational constraints. So that leads to one partial conclusion, which is that only when women are given autonomy to adopt contraception does it lead to what policymakers want, which is a decrease in unwanted births. But that is not the whole story. We also measured subjective well-being. And it turns out that, if you have access to contraception, by the way, this is only when women have greater autonomy to adopt contraception. That means that basically When we did the treatment versus the control, just having access to the voucher versus control, that actually, people did take up the voucher and use contraception, but that didn't lead to the decline in fertility. It really was only when women were given the voucher alone. And that is entirely determined by the subgroup in which men wanted more kids than their wives did, where there was a big gender gap in demand for children, which meant that women would be able to then implement their contraceptive preferences. Happens that their contraceptive preferences, their fertility preferences are similar to policymakers' fertility preferences. However, we also measured subjective well-being. And while everyone who has better access to contraception is better off than the control group, women in the individual group report being less happy and less satisfied in life than women in the couples group, which is surprising from, again, a revealed preference perspective. Because in the individual treatment, women could just pass over the voucher to their husbands. They could replicate our couples treatment themselves, but they don't. So either they can't anticipate what's going to bring them happiness, or they're making this horribly tragic trade-off between their own happiness and their quality of their relationship, and actually being able to survive yet another pregnancy happening in very difficult circumstances. So when we found that out, I spent a lot of time talking to the women, and they said, couldn't you talk to our husbands and help convince them to use contraception? And also, as I presented this to the Ministry of Health, so we work very closely with the Ministry of Health in Zambia, they said, since this is really coming from that group of couples where the husbands have want more kids than the wives do, can't you kind of do something about the preference gap? And I mean, for an economist to be told, change the preferences, that's very, very difficult. So we had to really think about what to do, and when you look at the big picture here, it's very, very disturbing. So the demographic transition, whereby, both fertility and demand for fertility decreases along with economic growth in countries all over the world, it's stalled in sub-Saharan Africa. But actually, if you break it down, it turns out that women's demand tracks economic growth perfectly. It's men's demand for children that's remaining high, and so the gap is increasing. Of course, there are many things that can determine that gap, very few of which we could change. The one thing we look at is whether information about the costs of childbearing can affect this. And in particular, we look at maternal mortality. And of course, there's one big question of why this information doesn't spread in the household already. If the wives know it, but the husbands don't, and that's what's causing the difference in demand, then you would think that they would just communicate about it. But that's what we discovered when we started the work. So we started by saying, 1 in 27 women in Zambia die in childbirth. And so all the men put up their hand and say, oh, that's because they're promiscuous during pregnancy. And we said, no, that's a myth. Let's show you the science. And they kind of nod, and then they don't change anything. So we had to think about how to affect that mental model and then provide the scientific information. So we said, 1 in 110 women in South Africa die in childbirth. And they say, well, those women are different. So that's still consistent with their mental model. Then we say, well, 1 in 43 women in Zimbabwe die in childbirth. And I said, wait a second. Actually, we think women in Zimbabwe are more promiscuous than women in Zambia, and they're dying at a lower rate. So we say, let me show you some scientific reasons why there's other reasons that actually women may die in childbirth, and here are some things you can do about it. So we describe in vivid detail all of the medical reasons for maternal morbidity and mortality by a nurse, and then we track over the next year and a half the beliefs of both the women and the men, and we actually separately provide this information to women and men in the household, as well as pregnancy. And what we find is that providing information to husbands about maternal mortality halves the number of pregnancies. And that is really coming from this decrease in the gap in beliefs, which turns into a decrease in the gap in demand for children, which turns into a decrease in actual pregnancies. And none of that, far from coming at a cost to the relationship and to the marriage and to family unity, it actually enhances the relationship and the relationship quality. So this is something where, taking seriously what women are saying, which is this is also important to us, is the unity of the family, and also for the kind of culture in Zambia and the government in Zambia, this was sort of a way to provide that and also be able to get to this goal of decreased fertility. Okay, so just as there are two selves inside the household which may have different preferences, that may also exist within the individual. And so the last study I'm going to tell you about on the demand side is really going inside of the individual and the conflict the individual might face between the present self and the future self, which I'm sure is very familiar to everyone in this audience, not only from introspection, but from all your work on environmental economics. So obviously there's a big question of why don't the poor save? Why doesn't anyone, why is there sort of low savings around the world? And this could just reflect a standard discounting rate. And if so, then there's really no room for intervention. It would be highly paternalistic to intervene in this particular case. But that does seem contrary to people's desire to save and their stated regret about not saving when they do actually have income. So it really begs the question of whether you can actually trust revealed preference in this context. And as I'm going to argue to you, and from our results, you really can't, which is obviously a debate within environmental discounting as well. In particular, in this case, it really suggests a time and consistency problem, which we can identify where individuals are impatient in the short run and patient in the long run. And that's the standard problem that you all know about, which is, I'll start my diet tomorrow. And that structure of time discounting has been shown to be extremely important in multiple domains, in technology adoption, insurance, behavior in firms, and it suggests a demand for commitment, that you would like something to commit your future self. And this is an ancient problem that Odysseus himself had, to not be tempted by the siren's song, but he still wanted to hear it, so he asked his men to bind him harder, and even if he asked and begged to be taken away, he, please tighten the bonds and add to the bonds. So the fact that we would actually desire commitment and desire someone to tie our hands is what motivated us to design a commitment savings product, measure time and consistency, and test the hyperbolic discounting model to see to what extent people demand commitment and to what extent it can help them to save. So we designed this commitment savings product, which consisted both of a box with a lock where the key was given to the bank. By the way, when I'd go to the pilots, many people, just like Odysseus, had broken the lock, retaped the box, as well as a contract. This was just the certificate of the contract that we put up in people's homes. We also had a placebo treatment where you had a certificate like that just to remind you to save. But this actually belied a contract with the bank to not let you withdraw the money until a certain date or amount had been reached. And what we find, we measure people's time discounting at the beginning, at the baseline of the study, and we find that indeed it is the time and consistent people who demand commitment. Now that's only about 30% of people, but for that 30%, it is incredibly useful for them. So in a 6-month period, just averaging across the 30% who took up and the rest who didn't, right? So just an intent to treat, 6 months you get a 46% increase in savings, 12 months you get an 80% increase in savings among very low income people. And since that study came out in 2006, commitment devices have been shown to stop smoking, facilitate fertilizer adoption, achieve sobriety from alcohol, allowing us to use this insight of kind of individuals' long-term desires to at least offer this potential in the market for people to be able to take up. Of course, we don't take up products and services or access them in isolation. We're usually interacting with a human who provides them to us. And around the world, there is a big challenge of sort of these distribution agents who provide the services and products and help for individuals. And that can be particularly important for technologies. So let me tell you about a really important technology, which is the female condom. This is a relatively new technology that was the only way in Southern Africa that women could protect themselves against HIV. And this is, in a setting in Zambia, one of the highest HIV rates, around 14%. Young married women are the fastest growing demographic infected with HIV. Very hard to convince your husband to use male condoms. So female condoms provide a potential alternative. But like many new technologies, they are very difficult to learn. They need a lot of practice and trust. So you need a kind of innovative distribution method that is really embedded in communities where people can really trust who they're talking to, that they can kind of repeatedly come back. And what we found were hairdressers and barbers shops. Now, these are not like you would go to the hair salon here in Gothenburg. They're on everyone who's been to Africa knows they're in every street corner, everywhere. And, most people are there talking about all kinds of things. Then the question was, how do we want to treat those guys? Do we want to think about them as standard distribution agents where we give them a margin, a financial margin? Or do we want to think about them as a pure volunteer corps? Or do we want to be able to leverage some other way to leverage their altruistic motivation? And so what we do is we survey and geocode all the salons in Lusaka, which is 2,500 of them so you can get a sense of how many there are. We randomize 1,200 to 4 treatments. They learn about the incentives, and over the year we track their monthly data. Here they are, the 2 of the people in our study. Okay, and here were the 4 incentive treatments. Pure volunteer, a 10% financial margin, a 90% financial margin, and a non-financial incentive that we designed that was basically a thermometer that you could you get a star every female condom you sell, and you can see that it ties it to this community impact that you could have. So it basically is a way, just like financial margins allow a principle to tie the agent's marginal effort to the marginal financial profits of the company. This is a way to tie the agent's marginal effort to the marginal social impact that they're having. And what we find is that those stars on that thermometer were twice as powerful as a 90% financial margin. Now, a 90% financial margin in this setting wasn't a huge amount for these hairdressers and barbers. So I'm not saying that money doesn't work, but that money transformed into this form of connecting to social impact had a massive effect on the hairdressers and barbers promoting female condoms. And it's driven both by a warm glow effect and because we know the density, which sort of happened randomly within every cell, the more people you had in your cell, the more others you had with this, the higher was the impact, which can be from social comparison, from encouragement, or from learning. Okay, so again, we're in these kind of constant dialogue with the Ministry of Health. They learn about these results and they say, we're actually in this process of launching a new community health worker campaign. Can you help us design incentives based on stars? And we said, actually, we're a little worried about, applying this to a kind of a full-time job in rural areas. But let's discuss what else could be really important to design to be able to provide the most effective health services from these community health workers. And so before I tell you about that, I'll just tell you the setting, which is overall, globally, as I'm sure you're all very aware, there's a massive disproportion of disease burden, which this is a map of the world that is weighed and proportioned by the burden of disease. And this is in particular malaria there in that thing. Then when you look at the resources, this is nurses. So the disease burden and the human resources are almost exactly opposite in terms of where they are. And it's even worse for physicians. So in Zambia, for example, 13 million people, 913 doctors, most of them in Lusaka. So this is really a crisis in human resources for health. It exists all over the world in remote areas. And in Zambia, what they wanted to do was think about the role that community health workers could play. And there's community health volunteers everywhere. They wanted to actually professionalize and formalize the role, find people in communities, upskill them to become essentially proto-nurses for those communities. The challenge that they faced was they really want to bring people from the communities, particularly because it has not worked at all to try to train people in Lusaka and then send them out to communities. Nobody wants to go, and they don't stay there. However, the government was very worried that, once they become part of the civil service, they'll just, want to leave their communities. They'll want to just do their career advancement and not care about the very things that we're trying to bring them in for. So we said, okay, let's test that together. In the first stage of this program, in the pilot stage, with 146 communities, let's randomize the recruitment process and see if it matters who the type of person is that you get in. So across the country, we randomized whether people access this job through 2 different recruitment posters. On the left was a recruitment poster that was the standard way that community health workers were recruited, which says, want to serve your community, become a community health worker, very focused on serving your community and the benefits that come from that. On the right, across the other half of randomized districts in the country, was become a community health worker to gain skills and boost your career. And the benefits talked about the way you could move up the ladder. Now note that these are both consistent with the objective of the ministry. There was gaps at each stage of the ladder, but they were very afraid that this would bring in the wrong kind of people, the people who only cared about advancing their career. And they wanted people who were committed to the community because this work is incredibly hard. You have to go out into the remote households and do a lot of stuff that isn't actually monitored. These are community health workers. Then what happens is that these people are recruited, they're different, okay, they're brought in, but then once they are brought to training, there's a year of training, at which point they receive exactly the same incentives. So they're told, you know what, you will all get career incentives, just like any other civil servant, and you're all part of this big national core to help provide health services to the country. So that is a full year where they're together, and on the job, they receive the same incentives. So what you can be sure of is when you see the results, this is only a function of the type of person that was brought in. And what we see is that career incentives attract workers who do, first, 31% more household visits. That means this, and I mentioned these household visits are quite difficult because they're quite in remote areas. That essentially translates into 20,000 more visits over an 18-month period. And then we thought, to be honest, we were also a little bit kind of surprised at this, and we thought, okay, this may be coming, and at each stage we were discussing with the government, they would say, well, maybe this is coming at the cost of, maybe they're spending less time in the household visits, maybe they're targeting only the men, maybe they're going to the easiest to reach households, maybe they're not working during the weekends or on longer hours. We measured all of that, and none of that is true. 3 years on, they're just as likely to stay in these communities. And then, when we measure the administrative data from all the health clinics and hospitals that these communities feed into, we find that institutional deliveries in a country where 1 in 27 women were dying in childbirth go up by 31%. Children's visits to health posts go up by 24%. Under 1-year-olds receiving polio vaccination goes up by 20%. And then we do random household surveys across all these communities. We measure and weigh the children. The share of underweight children goes down by 25%. And so we shared this, and what we realized, was that basically in these communities, the career poster was able to attract people. Some of these people had 6 O-levels. And when even the people in Lusaka, the government officials in Lusaka realized that, they didn't even realize that there were these people with extremely high human resources in these communities. They just wanted a chance to stay in their communities and also develop their careers. And finding them meant that there was a virtuous cycle basically between human resource development and health services delivery. And due to this, the government of Zambia scaled this, as they were scaling up the program, they used career incentives to be able to recruit in all subsequent rounds. So when you take these 2 studies together, at first they might look slightly contradictory, but actually so the commonality on both of these is that material and non-material motivation doesn't have to clash the way we often think it does. There's such a large literature and crowd out. And to be honest, first of all, most of that literature hasn't been done in developing countries. A lot of it is not been done in a setting in which we could really understand what the incentives are actually signaling to people. In both of these cases, I think they just signaled that these services were valued. And so there was no clash between these two sources of motivation. And the second thing is, when I think about the hairdressers and barbers and what was leveraged there, that was a setting in which there was always another way to make a little bit of money. You could sell a wig, you could do some more hair, but there was very few ways in which you could actually be connected to social impact and make a contribution to your community. That's what was scarce in that environment, and that really motivated them. In the community health worker case, there were plenty of opportunities. There have always been plenty of opportunities to serve your community. But there were very few opportunities to actually advance your career and remain in your community. That's what was scarce in that environment, and that's what was leveraged and created for really strong effect. So I guess just stepping back and thinking about both what we've learned from the supply side of this co-production and the demand side. I think fundamentally, even taking as totally given existing technology, existing resources, we really can't solve the challenges that remain before us without deeply understanding kind of the head and the heart of the people who are creating a better health outcome, education, a better environment, development. And I would argue that, just as a last point to kind of leave you on, that just as human development, health, and a better environment is co-produced, and we don't want to think of ourselves as people who are giving this to other people, I would argue that knowledge is the same way. That we have traditionally thought of knowledge as the purview of scientists, and it's been kind of created in the ivory tower and then sort of sent down through all kinds of gaps to be able to make its way into policy. But the tragedy is not only that scientific knowledge doesn't often make its way into policy and that scientific knowledge gets lost to society, but also that practitioners and policymakers are creating knowledge themselves, and their knowledge doesn't make its way back into science and often gets lost to society as well. And so the field experiments that I've shared with you today were done all with the Ministry of Health from the beginning and the Ministry of Education in the government of Zambia from the beginning, which took a lot of building of trust and relationships to be able to design the questions that were both important for policymakers and for academics, for us, to be able to publish in those mythical journals and be able to advance the frontier of scientific knowledge, but also make an impact locally and globally in terms of policy. What that allowed us to do is not only come up with the questions together, but at every stage be able to share our learning and deepen both of our learnings throughout the process, so that when it came down to having the results, there was no question of like a dissemination meeting where we're asking policymakers to implement the study results. When I talked to the Minister of Health about our early results from the community health workers, and my partner from the Ministry of Health looked at him, he just said, this is our study, so of course we're going to implement this. So I think the fact that when people feel that it's their knowledge that they have helped to generate can make a very big difference. And so I would just leave you with that point too, is that all of us, sort of as we go out to generate knowledge together, the extent to which all of those that we are partnering with are generating knowledge, to sort of make sure that this knowledge can make its impact on society. Thank you.
Thank you very much, Nava. That was fascinating and wonderful keynote speech. We have time now we have 10 minutes for questions. So there are 2 microphones up there and 1 down here. Please raise your hand, be clear if you want to ask a question. At the top here, just wait for the microphone. Thank you. Anyone else? Okay, we'll come to you second. Okay, sorry about that. Didn't see you. Thank you.
Regarding the STARS method of motivating people and applying it to a more countrywide approach. So I guess the benefit of a STARS thing is that you display it publicly and then can be proud of it, basically. So could you replicate something like this by having a list posted by the government on their website or any other easily accessible place of the best health workers in our country or something like that, so a ranking?
Yeah, so the study I didn't present is actually, we tried that while the community health workers, for the year that they were in school, we actually did 5 different treatments of public acknowledgement, private acknowledgement, recognition, and as a way of seeing whether we could, what the effects would be. It turns out that very strongly affects the top tier, but demotivates the lower tier because it provides social comparison. Now, that doesn't matter in sales or innovation, for example, because all you care about is motivating the top tier, and they can substitute for the lower ones. In this case, where actually no one can substitute for that community health worker that's in that remote area, you don't want to demotivate any part of the distribution, and so that's why we didn't go with that.
Terrific question, thank you. Question down here, thanks.
Thank you. It's not on. Oh, okay. Thank you, Nava, for a great speech. I want to reflect on, my name is Jonas, I'm based here at the Department of Economics, University of Gothenburg. I wanted to comment on the self-control and commitment issues, where behavioral economists and psychologists have long documented that we suffer from commitment, self-control issues. But the reasons are different in the context of developing versus developed countries. In urban Tanzania, we found similar results as we did. We distributed LPGs on credit, and we asked them to pay back the credit amount by varying the payment scheme. Some were given daily payment option, others weekly, and others monthly. And the guys that were given the daily option paid more, actually. And we asked the guys that didn't pay in the monthly treatment, and they say that, well, I have a hard time to save the money for the entire month, mainly because of the pressure that is coming from the extended family system. So what I wanted to say is it really, from policy perspective, do we have to focus on the individual or really try to address the major, larger societal problems like lack of social security to reduce the problem of commitment?
Yeah, I mean, I think you're quite right that actually we have a lot of mechanisms and products in developed countries to actually deal with that much better. You know, in this case as well, we wanted to separate out self-control, and actually I have another paper called Spousal Control that is really about the intrafamily constraints. But here, you know, I think the fact that the individual time and consistency predicts the commitment suggests that there is both an individual challenge and a household challenge and a community challenge. So at each level, we can provide these products.
Yeah, really fascinating. Thank you very much. I think you really were onto something when you said that it's looking for the scarce resource here, in your contrast with the hairdressers and the social workers. And what I'm wondering is, what should I take away from this? Do we need to go out there, health problem by health problem, and think about what the scarce resource is given the institutional structure? It seems to me, don't we really want to say that, well, if we had created a system of opportunity where the hairdresser didn't require a system where, you know, what is it about the macro prices, in some sense, stepping back, that are wrong, that means that the person who wanted to actually do their calling couldn't get there in the first place? And so it's really thinking about institutional design at a much more macro level rather than thinking about how can we make this policy work better or that policy work better. And so thinking about sort of equality and opportunity and what's going on in schools that lets people get to the jobs and the careers they want to.
Great question. I think we don't have, you don't have to do this health problem by health problem, but you probably do have to do it kind of industrial sector by industrial sector, in that sense. That I think the question you're asking is about allocation of talent and why people decide to go into one job versus another. If they crave social impact, why are they going into hairdressing? Or if they want a career, why are they sort of remaining in their communities? I would argue that actually all of us have both motivations inside of us. And often, as you know, in developing countries, people do what is their fathers did or they need to do, or what, as you say, what's available in school. I actually think the solution is not necessarily to help within the schools, although we're also working on that, to be able to better match market opportunities to people's skills. I think it is also just generally understanding that as humans, we have both sides of us, and we need all our jobs to address both sides. So we're actually working now with bankers as well, because that's actually very scarce for them to feel a connection to social welfare, but in fact, they could feel it strongly. So I think it would be just saying, in any given, if you're looking at any delivery process, are you adequately addressing both sides of people's motivations, instead of just focusing always on financial incentives?
Terrific questions. Thank you very much. Another one at the front here. Come on, top row. You can do better than this.
Exactly.
So I have a methodological kind of comment/question, which is to do with RCTs in general. So I'm engaged in planning one of them myself right now. And one of the things that goes into all of this is that you take maybe 100 decisions along the way before you get to the final design, right? And that process of taking those decisions is a learning process at the level of the individual researcher, but it's not only at the level of the individual researcher, it's at the level of the research community as a whole. So, to move away from our field and go to where, RCTs were first used, which is in clinical trials, medical trials, the process of selecting what drug is going to actually make it to the testing stage is a very long process. It's usually at least a decade, if not more. And it involves a lot of research along the way. And what I'm thinking is basically that I'm sure that you told us about a bunch of very interesting studies, but that there's a lot of information behind that which you haven't told us, in the sense of all those decisions you made along the way, all the stuff you learned about various other alternatives. So at the end of the day, basically, we are selecting, at the most 3 or 4 treatments, and those are the ones that are going to be tested against each other and against a control. But of course, there could be hundreds of other things that you could have done, and things that you considered, and that you learned along the way when you went to these places, talked to people, et cetera, et cetera. And I'm just thinking that that's a lot of learning and knowledge over there about all the other dimensions which don't make it into the trial. So the trial is basically just a comparison of 3 or 4 alternatives at the most. But there are actually thousands of other things that could have been tried or could be tried in the future, et cetera. And so my question is, how do we kind of get that kind of learning and knowledge also out there, rather than just the stuff that's finally published in the trial?
Yeah, I've thought a lot about that, actually, because we were talking with Peter this morning about the uses of anthropology for economists, and I certainly spend a lot of my time in the field, and so do my graduate students, and there is a lot of learning there. I guess to me, that is the uses of theory. Because ultimately, as economists, we are structured by theory and by the historical progress of theory in our profession. And so if we're at a point in time in which we have particular models of discounting, or particular models of household efficiency, or particular models of price and usage, these are the models that we would want to test. And for me, I kind of today shared a lot of what I experienced in the field, but I am equally motivated by where are the gaps in empirical testing of theories that are taken as given, for example, on crowd out and things like that. So what I particularly look for is where in our frontier of scientific knowledge do we have economic theories where there's a paucity of empirical evidence, and then I match that with the opportunities that I see in the field to be able to illuminate that theory. That also allows us to extrapolate far beyond, Lusaka, Zambia, hopefully, and be able to really understand something more fundamental. And I just think that's the only way incrementally that we can progress, as economists and as a discipline itself, right, is by a constant dialogue between what we learn in the field, empirical testing, and kind of where we're at in terms of the frontier of theory.
I've promised Gernot a question. I'm hoping it's a quick one. Probably not. Go on.
I'm trying. Hi, Nava.
Hi.
My wife is an abortion doctor, a reproductive health gynecologist. I'm here, so worlds colliding. Fairly selfish, but sort of speculative. What are the top questions at the intersection, right? Health, development, environment, that you or any one of the 1,400 people here should be working on?
Oh my God.
Okay, that was a mistake, wasn't it?
Ben?
This is on you.
Actually, I kind of thought, when I first came, I thought that what Ben and I were going to do was like a tag team presentation. So I thought, Ben can bring the environment, I'll bring the development. And so, this is the kind of answer that... let me tell you one thing that, I've been so focused from the behavioral economics side on the individual decision making, right? That this supply side factors, we think about technology, infrastructure, but the people, getting the right people in the job, and going back to the allocation of talent question, it is unbelievable the effect sizes. It's credible, I trust them, but it is extraordinary to me that getting the right people in the job can make such a difference. And so for any of these things where we think about, we can design the very best policies, but the implementation is so crucial and depends on having the right people to be able to do it. That seems particularly important.
Well, thank you very much, Nava. That was fantastic.
Thank you. Present. Thank you. Thank you.
Okay, I nearly screwed it up at the last moment there. Excellent. Now I need to invite Thomas up, who's going to introduce the next part of the plenary session. Thank you, everyone.
Right, we're slowly approaching the end, I'm afraid. First of all, I'd like to welcome the three presidents up on stage. Diane is here for Laura, and then we have Carlo and Shikui Shang. So please come up. You have about 6 or 7 minutes.
Well, we are approaching the end. I didn't even wear the tie this morning, so I'm quite relaxed. Thomas is even worse. He just has a T-shirt, so it's even more relaxed than me. I think it was a great conference, and as Ben said at the beginning, I'm quite grateful to all of you for having contributed to the conference. And of course, we're grateful to the organizer and everyone else who have been made this conference possible and quite effective. There are some innovative features in the conference that I would like to underline. For example, we had some poster session, hack timer session, and we had 2 wonderful policy sessions. I introduced the policy session 4 years ago in Istanbul. I had plenty of discussions with Thomas about plenary policy session this year in Göteborg. At the end, we had 2 with Gina McCarthy, the first one, and Sjosterbeke, Gina, Erin, and Wang in the second day, and they were quite useful. I think it's important for us to measure our own impact, how relevant is what we do, and this last plenary lecture, the policy sessions, and even more in coming conference will try to give us indicators of the relevance of the work we do, indicators, signals, vision that identify the impact of what we do. So that was good. It was good in particular because of the scientific committee. We praised a lot Thomas, and he deserves it, but certainly the chairs of the scientific committee have been doing a great job. Of course, the whole committee, but in particular the 4 chairs. So if they are here, I would like to ask Ben to come here. I think that you didn't see them, so Ben, please, and Friedrich Carlsen, if he's here. And please come, and Sun-Shuke Managi, and Gernot Wagner, are they here? Maybe not. Please come on the stage, because I think it's important. At the end, this is a scientific session. I think the value of the conference comes from your own work, the scientific work which is going to present it, and the way in which they arrange this program, and the way in which sessions have been prepared, and so on and so forth. So I think that both the local organizer and the scientific organizer, those preparing the scientific program, deserve a lot of recognition and gratitude. Let me stop here. I think that I'm quite happy to have contributed to this conference through the members of the association, through the council of the association. I welcome all of you to next year conference. It will be in Manchester. It will be a nice one again. And I look forward to meeting many of you, not only Europeans, but also those coming from other countries to the European conference next year. One final word. After this plenary session, I'll meet with the president of the other associations, and we'll start preparing the next World Congresses in 2022. I think that it's an important process. We need to start now to identify where to have the conference, how to manage, and in particular, how to open the conference even more to associations and economies from other countries, other regions, and make it a really World Congress, even more than what we succeeded in doing here in Göteborg, thanks also to the many grants that Thomas has been able to get from different sponsors that made the participation of economists, environmental economists from developing countries possible. So thank you all, thank you again, and see you next year.
Hi, I think what our Carlos said is what I'm going to say, but I still want to say a few words. One is congratulations. I think we should congratulate every one of us, because we all work together to make this conference to be not only just productive, but a very enjoyable one. I see the great singers here, and we find that we're not environmental economists, but we can also be very good professional musicians, keyboard singers together. And the second word, I would like to see that we have observed the continuing trend of changes, not only just a high participation, but also wide coverage of the topics or issues and the future issues towards the Anthropocene and uncertainty world in the future. And also we also visited our classical theories, formulas, and methodologies. They all make these conferences to be so rich. And also I think our community also share very beautiful stories, because I think Thomas, Dale there, you always have your former students, and you co-authored a paper several or 20 or 10 years ago, and now your colleagues and you are challenging each other, you debate with each other. This is very beautiful stories of this community. I think those kind of stories will like a legacy of those associations. And the third word I would like to say, appreciation. I think every good memories we have, you know what I'm going to say. Thank you for Thomas and your team, and thank you for the program committee. It's not so easy to make 1,000 papers together at 25 parallel sessions, and to encourage all those one to keep everyone to be in the meeting room. It must be attractive. We all know that, how difficult it is. Thank you so much, and thank you for all the keynote speech and all the presentations. I think we all inspired by the presentations, discussions, and I look forward to see you all in the future. Thank you so much.
Hi, I'm Dan Fineff, the president-elect of ARI, and I'll just simply echo all the things the other speakers have said. Thank you so much for a wonderful conference, and thank you, of course, to the organizers. I'm going to take the prerogative of asking for yet another hand and thanking them, so please. So we're getting ready to say goodbye now, but of course we have many opportunities coming up in the future to interact some more. So I know that eARI conference will be at the end of June next year, and Thomas will talk about that. The ARI conference will be in the beginning of June next year in Lake Tahoe, California. So I encourage all of you to pay attention to that and think about attending. So once again, thank you. Safe travels home. Wonderful conference. Thanks to everyone.
So we're not quite done. Wow, and then there's the party in Mashtan. So, but we've got the best poster prize, and I hope the winners are here. We've had a committee which has been working hard to select the prizes, and they have decided, I'm reading on their behalf, to share the prize, in fact, between Baela Tibesiwa for her project on the value of wild pollination services to crop productivity. What does gender of the smallholder farmer got to do with it? And Edouard Sivel for his project Green, Yellow, or Red Lemons, an experiment on the perception of houses' energy labels. Both of these have a gender aspect. Baela and her co-authors, they combine data on household cropping patterns with spatial data on forest cover. And they find that the changes in forest cover affect male and female farmers differently, because the women farmers grow crops that are more sensitive to wild pollination. They care more about the bees. We already talked about the bees. There's only half of them left in Europe. So, Edward and Nathalie Cruz, they use an experiment where subjects in France are shown real estate advertisements with energy labels. And again, they find men and women look at the labels and read them differently, with the men focusing more on, guess what, the technical information, while women are wisely taking everything into account. Both projects and the posters were presented very well, with a lot of nuance, and it's nice they bring in this gender and environment aspect together. So I'd like to let the two awardees, are they here? Let's see, where are they? Please come on stage. This is for you.
Okay, thank you, Thomas.
Thanks so much. Well done.
Thank you.
Big round of applause for Baela. Goodbyes are painful. There's still some sessions left on the afternoon, so we're still going to have some interesting, and then we're going to have some fun and much fun, some of us. I get asked by journalists, what was the conclusion? So you spent a week here. Can you give me the preferably 1 or 2 bullet line conclusion? My first reaction was, I don't want to say I'd hate to admit that I was condescending, but I was thinking, yeah, I don't understand. Right? This is a scientific congress. This is the normal progress of science, what Thomas Kuhn referred to as normal science, right? But I think we can do better than that. I think there is a conclusion. One of them is really that quality matters. Right? This is science. This is a celebration of science, and we've seen this in these wonderful plenaries, how bringing really the best, first of all, the best of the hard-nosed economists. But then, not only that, but the econometricians, the statisticians, the psychologists, the anthropologists, the ecologists, the physicists and chemists, and so on, we have rather hard problems here. And we have to get the best minds, the best analysis. We must never fall into the trap of thinking we're some little sect, we're doing things our own way. We must always interact with the people at the frontier in each of the core disciplines. That's so important for our careers to get into those journals, but to solve the problems we're facing, because we're not making a lot of progress on that, remember? Still need to drink a lot of water. I think also there's a few other conclusions we'd agree on. And prices matter. That has to be said with some nuance these days. It's not just prices, and it's not just any price at any cost. It's not that other policies don't matter. So it's a more complicated picture. But that isn't really distant from our theory. We are taught to think of both the supply and the demand, and these are very complicated, and it's not so simple that there's always just going to be one price that solves things. Environmental economists are needed. We even talked here that it's time for a world association. Not long ago, Carlo started with a handful in Venice and suggested a world conference. And now we're thinking, well, maybe we should be a world association of environmental economists, maybe just made up of the associations that already exist. Tied with this is the important need for capacity building. It is a tragedy that I have mentioned before. When you come to these meetings that decide the future in various aspects of our globe, like the climate top meetings, and there will be a delegation with 35, brilliant PhDs in environmental economics from the US who are not really able to say what they really would like to say, and then because they got instructions. And then you have big countries like Nigeria or South Africa, and they've sent a master's student. It's unfair, and there's a lot we can do to help bridge that gap. And we have been very keen on doing a small part in that here by making this particular event, a little bit more global than usual, but it's still far from representative, as you can easily see. This week has been a lot of fun. I hope you agree. But I can't hide that there was a lot of work behind this. These conferences structurally a little bit underfunded. Even when we're privileged, as we are, to have good facilities in the School of Economics, which, since this is summer, we could use the school without paying much. But on the other hand, in Sweden, salaries, catering, alcohol, and a lot of other things are extremely expensive. And we wanted to keep fees reasonably low. We wanted to subsidize these fees to get people from countries with lower income. And so this wouldn't have been possible without a lot of sponsors. And I can't thank, actually, there are so many sponsors, I can't thank them individually, but I'll say something about some groups, because I want this community to grow, and I you know, since we had some success with looking for sponsors, I thought this is something I can pass on to so I'll talk about some different groups. First of all, we got the university. The university gets goodwill out of events like this, and so they should contribute something, and our university has been very generous about that. Then we've had some institutional, we've had the Environment for Development, we've had, most importantly, SIDA and the Agence Française de Développement, who have contributed particularly to making this more global. We've had the city of Gothenburg and other regional bodies like the county and that kind of thing, and the Swedish Environmental Protection Agency. We had one big local foundation here called the Adlerbergska. We did get some private business. Nudie jeans, for instance, they provided these. So I wanted to call the crew nudies, but that was censored. We got Volvo, we got Microsoft, thanks to AER, AER area, I mean, usually has, or has previously had some sponsorship from, and they suggested this generally to us, and then they sponsored the world. So talking to other previous conferences can be useful. That helped us make this link with area. I'm very grateful to the Americans for that. Actually, it was Vic, I think, who made the connection. Here is the sort of the entire sleuth of sponsors that should be thanked, and now they are all properly thanked. But I'd like to point to one category that you might not have thought of, that I think is an innovation, and that is actually other researchers. And at least in Europe, there's a lot of big funding coming in sort of not the traditional pure research, but some other forms of research funding. The European Union has a lot of this in its Horizon. If you have an EU Horizon project, they require you to do a lot of outreach. So I have gone to the people, the friends, colleagues who have EU projects, and I said, I know you have to do all this outreach shit and talk to stakeholders and have an event and stuff, and you don't like that because you just want to get on with your research. So I said, well, if you give me a contribution, my conference, I will put on the best outreach you could get. And so some of our thematic sessions have been funded in this way, and it's been, you know, the funders have been pleased with this. And we have sometimes, it has helped bring in interesting policymakers to discuss some of the research, and it has actually improved the quality of the many policy and thematic sessions you've seen. And so there were a lot of people and institutions, and I won't read all those, but they are all collectively thanked very much here. Then we want to thank the speakers. First of all, of course, the plenary speakers. Fantastic stars here. But in fact, the thematic, the policy, the parallel, the egg timers, the posters, all of you, you're all stars. I want to thank you all. Let's give you a round of applause to ourselves. That is the conference, and as Carlo was saying, it's that scientific program. Now, normally, if this is an ERI meeting, we have a whole presentation of the sort of the Manchester. So this time, Carlo mentioned a little bit, and Dan mentioned a little bit, but I just put these up here. We are all welcome to go to the American or to the Asian or to the European Association meetings. We are a world community, so here they are, and a big thanks to the three associations and their presidents, and welcome to all the 3 meetings that will be next summer. This is a private plug from Back to Science, right? We thought with this app that we would get, we're doing a survey of your opinion on a number of important issues like prices and stuff. And so we thought with this app that if we reach everybody and everybody would fill in our questionnaire immediately. It hasn't worked that way. Maybe this conference has had too much other stuff going on. But maybe on the plane back or something, do our survey, please. Now, this has been a big team effort, so I'm coming to the most emotional part of this, and I want to thank the whole team. It's been a gigantic, big team. And first of all, I'd like to start with Fredrik. Fredrik is such a role model, such a great researcher, such a great teacher, such a great friend. He puts on this tough attitude. I'm not taking this shit. And if anybody wants to move a session, I'm not, But in fact, then he's soft as well. Not quite as soft as me. He's a little bit tougher than me. But he still accommodates all these, stupid requests. There's a football game on Wednesday, so could we put my session on Thursday? He's been as kinder than he really thought he would be. The program committee with Shunsuke, Gernot, and Ben Grum has been a dream team, and in particular Ben actually traveled all the way up here to the Arctic and spent time with us in April or whenever it was. That was very important, Ben. Thanks so much. And then we've had a local, program committee with Jonas, Inge, Jessica, Marion, Klaas, Mitesh, Gunnar, and Elina. So I'm thinking you should all come up gradually on stage. So in a moment you'll all come up, but there's still a few. There's been an inner circle of the local organizing committee here, and I'd like to start with our Chief Operating Officer, Åsa Löfgren. She is not only a wonderful researcher, but also a fantastic administrator. She saw that I was sinking in trying to organize this and said, look, Thomas, I'll take over and help pull this together. And so she's kind of mothered me. I like mothers. I mean, if my mother had still been alive, she would have been here. She kind of taught me to speak, so that was useful. Now mothers are getting younger. It's a strange experience, but rather nice. So, thank you, Åsa. Anne has been the captain of this ship. I can't see her. There, okay. And steered it capably. And so we're all deeply indebted to you, Anne. Thank you very much. Frida, here you are, Frida. Thanks so much. She's been our pathfinder. She's helped solve lots of problems, and really, she's a budding political scientist, and really wanted to do research assistance. So sort of with some hesitation got roped into organizing, but she's done this very graciously and very capably. Inansh, you hear Inansh? Yeah, great. Inansh has been my personal Sherpa and has helped create some order out of all the mess of all these thematic. We've had like 10 times more thematic and policy sessions than normal, and he's helped kind of put them in order and helped keep me in the right place. Gunnar, of course, is, if I have a mother here, then Gunnar is my brother. I don't know. I don't know what to say. That's the thing with brothers. I don't. Yeah. We've had a lot of collaborators, Meetex, FlexiMeets, and Dimi, who is Dimi? She's probably here, or else she's making sure things running smoothly somewhere. And the restaurants, I'd like to thank the restaurants. We did suffered through a lot of tasting and discarded some restaurants that were close and cheap and nice in other ways, but just the food wasn't good. And so we hope you've enjoyed that aspect. The crew, the nudies, the ones wearing nudie shirts. And we've had a lot of support from the whole department. We've had, the hosts and the chairs for the plenaries, the communication admin, janitor's office, IT. You don't know how many people are involved in a school, housekeeping, security, staff, catering, and so on. And our wonderful Toastmaster, Lisa, the entertainers, my cheese guy, Ostandish, Joe Vicky, who has managed our connections with the church here and the plenaries. So we have a whole wonderful group, the Environmental Economics Unit, and that's made this possible. There are so many, Inge there, for instance, Marion, Daniel. So now it is time to come on stage, please, all of you. Gernot, you've been part of this. Olaf, come on, Olaf. Håkan, Klas. Lunch.